Hi, my name is Neal Dikeman, and I'm running for United States Senate. I'm the Libertarian nominee for Texas in 2018. The policies we're going to work on today are health care. Health care is one of the top-ranked issues when you start asking Americans what do they care about. So why are people so mad today? Well, they're mad because despite the fact that we have great doctors, great hospitals, and frankly a great health care system, we have an absolutely awful healthcare funding model. In fact, our model is so bad that people are ready to go to single payer to get away from it. Single payer is one of the worst ideas on this planet. That tells you exactly what the problem is. Our right has basically been protecting a bad status quo. Our left has been so bereft of ideas that they're trying to junk the whole thing and go to a system that simply isn't functional, let alone fundable. And as I keep getting told, well, hey, let's just expand Medicare. No, we're not going to expand Medicare. Why? Because Medicare is barely solvent. Because we haven't actually been paying all the bills for the past generation for Medicare. If you expand a bankrupt system because it looks cheap, you're going to get what you pay for. What's the real issue here? The real issue is simple. In 2018, your health care is still tied to your job. That's morally bankrupt. Your health care shouldn't be tied to your job. Your employer shouldn't know anything about your health needs. Your government shouldn't know anything about your health needs. It's not their business. But it has been in America since almost the beginning of health insurance. People say, hey, the free market's not working well, so we got to go to a government-run system. No, guys, the free market has never existed in healthcare. We are running off of a 1940s tax deal. Let me tell you how this started, why you actually get your health insurance through your employer. Back during World War II, the government didn't want companies gouging them and basically running up prices on labor, basically increasing wages, in order to keep you from leaving to go help out the war effort. So they said, no wage increases while we're at war. The unions and big corporations were understandably concerned about that, and so there was a back-end deal thrown in. It's real simple. There's this new thing called health insurance, which only the big companies, heavily unionized companies, could afford at the time. So what do? Said, all right, those companies, they can deduct all the healthcare costs, including the premiums for the health insurance, and give them to their employees without a tax increase. Like, hey, you don't pay taxes on the health benefits your employer gives you if your employer pays for it. In a weird, absolutely nutty way, what that means is if your employer gives you a check and you buy that insurance directly, the government charges you taxes on that check. But if your employer writes the check through their own plan, the government doesn't charge anybody tax. It's one of the biggest corporate giveaways out there. Why is that bad? Well, because here's what's happened. We're actually already in a four-payer system. Not one payer, but four-payer. We're pretty close. In every state, there's basically 3 insurance companies that control 50 to 80% market share, plus Medicare. You got 4 players at most controlling all the health insurance. But they don't just do insurance. Those insurance companies work for your employer. They work for your boss. They go in and they sell your company on allowing them to run the healthcare system. And they sell them based on the fact that, hey, we've got a great deal with all these doctors and all these hospitals. It's our network. And they sell them, hey, we got this great network, so we'll be able to control costs and take care of your employees, and here's the deal, please sign us up. And of course, the businesses aren't allowed to sign up more than one healthcare insurance company, so they only get one insurance company, one network, and your choice is gone. Whatever company you work for, that's the insurance you get, and that's it. Which is fantastic until you realize that costs have been outstripping economic growth for decades, which makes no sense. No other industry works that way. The insurance company, well, they basically work for your employer. The doctors in the hospitals work for the insurance company, and nobody works for you. And when nobody works for you, the system doesn't work. This isn't a free market system. This is an oligopoly set on top of a tax deal. It's a cartel, and we need to stop it. We don't need to take our 4-payer system, which is not working, and go to a 1-payer system, which has all the same problems as the 4-payer system, except it's the government instead of the health insurance companies that are making the calls. We need to go back to basics. We need to reverse the tax deal so you get the deal, not the big corporations. We need to make sure that insurance is just insurance. You and I can walk into an insurance company and buy insurance. Then we need to make sure that healthcare is just healthcare. I mean, the insurance company shouldn't be in the business of picking your doctor or your hospital for you. Why would they? They're an insurance company. They're about selling insurance. The doctor and hospital should be serving you. You should walk in and pick the doctor and hospital that work for you. And we saw this in the big debate over ACA. People said, hey, I want to keep my doctor. I want to keep my plan. What they didn't realize is that's just not the way the world works. Because all those doctors and plans are tied to that insurance. Change the insurance, you change the plan. The real kicker in all this is we actually put in place in the ACA a marketplace. Now, imagine a world where we claim it's a free market system, but the free market system only works if the government sets up a marketplace. It's an oxymoron. So let's go back to the fixes. We're going to unwind that tax deal. We're going to go to a million payer system. In fact, 100 million payer system, where every family in America can get the same deal that the corporations get with that insurance company. No special backroom deals where the insurance company can offer a group policy to your employer but won't sell you the same service. Next, the doctors, hospitals, they're going to work for you, for me, not the insurance company. No more doctors and hospitals walking in and saying, hey, I'm sorry, I can't serve you because you don't have insurance that's in my network. I don't take that network. No more networks. Sell fee for service to me, just like everyone else. How am I going to pay for it? Maybe it's cash. Maybe I'll borrow from my mom and dad. Or maybe, just maybe, it's that insurance policy that I purchased from the insurance company. And when I would run up the service, I say, look, I got insurance to cover that. But you don't send the bill to the insurance company who sends it to my employer who sends it to me. You send the bill to me, and I make sure the insurance company pays you. And one final little piece there, basic concept, the good faith estimate. Everyone here has been in a fender bender. You go into an auto repair shop, or your car's not starting well, and you know something's wrong. You don't know what. You're not an expert on cars, so you go into the local auto repair shop. The guy there has not had 10 years of medical school and residency and all the rest. But when you show him the car and say, hey, what's this going to cost? He can give you an estimate. And it's a pretty good estimate. You go into your doctor's office, your insurance company, or a hospital, and you say, hey, I've got this problem. I need you to treat me. I need some service. And you ask them what it's going to cost. Tell you what, the doctor and hospital, they say, I can't tell you. Why? Because we haven't asked your insurance company how much they'll pay us yet. Guys, I didn't ask you how much do you think you could get out of my insurance company by messing around with the billing codes. I asked you how much does the procedure to treat me cost? They won't give you an answer because it's not to their benefit, because they don't work for you. They work for the insurance company. So from now on, no more of that. If you don't give me a good faith estimate, just like any corporation in America, I'm not going to pay your bill. You tell me it's going to cost $1,000 and you send me a bill for $7,000, or better yet, a bill to my insurance company for $20 and then negotiate it down to $1,500, then call me and say, hey, I charge your insurance company the only $1,000. They say you'll pay the $500. Like, no, you didn't give me an estimate up front. You went and negotiated some backroom special deal out of sight of me on my procedure with my money with that insurance company. You don't get to send me an extra bill. Health insurance shouldn't be this hard. If we hadn't launched the entire industry off of a really bad tax deal with corporations and allowed our insurance companies to grow up addicted to it, and our companies to grow up addicted to it, and to allow our doctors and hospitals to grow up addicted to it, we wouldn't be in this mess. We all want the same thing. We all want everybody in America to be able to afford health care. We all want great health care from the doctor we like in our neighborhood. And we can have that. Not with a 4-payer system, not with a single-payer system, with a million-payer system. So let's not just kick the can down the road anymore. Our Democrat colleagues and our Republican colleagues have each had their shot at trying to fix this system, and they've butchered it every single time. No more. Let's get it fixed. I'm Neal Dikeman, and I'm running for United States Senate as the Libertarian nominee from Texas. Thank you.